steam therapy or Tuob in Bisaya, an effective way to fight COVID-19? Part 1. What is a steam therapy or Tuob and how to do steam therapy? Steam therapy, also called as steam inhalation, is one of the most widely used home remedies to soothe and open the nasal passages and get relief from the symptoms of a cold or sinus infection. Steam therapy involves the inhalation of water vapor. The warm, moist air is thought to work by loosening the mucus in the nasal passages, throat, and lungs. This may relieve symptoms of inflamed, swollen blood vessels in your nasal passages. How to prepare? We will be needing the following materials. The process: heat up the water to boiling. Carefully pour the hot water into the bowl. Drape the towel over the back of your head. Slowly lower your head toward the hot water until you're about 8 to 12 inches away from the water, and then immediately close your eyes. Lastly, inhale slowly and deeply through your nose for at least 2 to 5 minutes. We have important tips for you. Number 1. Be extremely careful when lowering your head toward the hot water to avoid making direct contact with the water. Number 2. Do not steam longer than 10 to 15 minutes for each session. And number 3. You can repeat steam inhalation 2 or 3 times per day if you're still having symptoms. Part 2. What are the benefits and risks of steam therapy? The main benefit of breathing in moist, warm steam is that may help ease feelings of irritation and swollen blood vessels in the nasal passages. The moisture may also help thin the mucus in your sinuses, which allows them to empty more easily. Steam inhalation also may provide some temporary relief from the symptoms of the common cold, the flu or influenza, sinus infections or infectious sinusitis, bronchitis, and nasal allergies. Part 3. Is steam therapy an effective way to fight COVID-19? One review of 6 clinical trials evaluating steam therapy in adults with the common cold had mixed results. Some participants had symptom relief, but others didn't. Additionally, some participants experienced discomfort inside the nose from the steam inhalation. Another recent clinical trial looked at the use of steam inhalation in treating chronic sinus symptoms. The study, however, didn't find that steam inhalation was beneficial for the majority of sinus symptoms, except for headache. While steam inhalation can provide subjective relief from the symptoms of a cold and other upper respiratory infections, it won't actually make your infection go away any faster. Steam inhalation doesn't actually kill the virus responsible for the infection. At best, steam inhalation might make you feel a little better as your body fights your cold. Although the results of clinical studies have been mixed, anecdotal evidence claims steam inhalation helps alleviate headache, congested or stuffy nose, throat irritation, breathing problems caused by airway congestion, dry or irritated nasal passages, and cough. If you experience any discomfort, pain, or irritation from using steam therapy, stop using it and look for other ways to alleviate your symptoms. Like many home remedies, always proceed with a grain of salt. What works for one person might not work for you. Steam inhalation may be an effective way to clear up your nasal and respiratory passages when you're sick with a cold or the flu, but it won't actually cure your infection. Your body's immune system will still do the bulk of the work to get rid of the virus causing your symptoms. And if you're feeling under the weather for more than a week or have severe symptoms, make up an appointment to see your doctor.